Yeah, that's recording.
Okay. Please tell us your name.
Evelyn Rodriguez Baez.
And Evelyn, tell us a little bit about the history of your back and how much pain that you have actually suffered. Now, we didn't ask you to make any false statements here.
Right.
And you agree to do this on your own,
Yes.
willingly, and nobody told you to make up anything or say anything that's not true.
Yes.
Isn't that correct?
Yes, correct.
Okay. A little bit about your past.
Well, I've been suffering from back pain since 2005. They've done surgery. They've inserted pins. I've had a stimulator.
Where did you have the low back surgery, or?
In Vineland.
No, where did your low back was operated on?
Yeah, the lower back was operated on.
Okay.
And they inserted a stimulator in my spine to help with the pain. I'm on serious pain medication. And all these years, I've never had as much relief as I've had since I came here.
Okay, but tell us, okay, so in the past year, you've been suffering every day.
Every day. I don't sleep. I haven't had a good night's sleep, and I would say since my back problem started.
Which was what year?
In 2005.
So for 7 years now, how much would you say you sleep every night?
Maybe 2 to 3 hours. On a good night, 3 hours.
Okay, and then you wake up in pain?
And I'm in pain.
Do you take pain meds after that?
I take pain meds.
So
all
you
day
have
long.
to wake up and take them to go back
Yes,
to sleep?
to
Is
be able
that
to go back
correct?
to sleep. It takes
I
me
see.
usually about an hour, 2 hours, sometimes 3, if I can go back to sleep.
Okay. Now, why did you try chiropractic? Pain management doctor?
My pain management doctor recommended it to try it for my upper back, and I came here to see Dr. Probe, and
Okay, tell us what happened. I gave you an examination.
yeah, he adjusted
Well, hold
my
on.
back.
Were you afraid to come here?
Yes, because after my back surgery, I didn't think I could go to a chiropractor again.
Okay. So you came in, we gave you an exam, we gave you an adjustment, and then what happened?
And it hurt for a little bit, and once the soreness was over, I slept like a baby
Now
all
tell us
day
about
long.
I want to know about how you slept. Tell me about sleeping.
I slept all day. I got up to eat, sleep, and I slept. I would say out of 24 hours, I was up maybe a total of 4 hours.
So you slept 20
Just
hours after
about,
your
yeah.
first adjustment.
Mm-hmm.
And before that, you couldn't sleep more than
No,
3 hours
More
in
than
one
3
night.
hours in one night.
And so now that you've had 4 adjustments, it's your 4th day. Tell us how your body feels compared
I
to
feel
when you
great.
came here.
What
What level was your pain out of 10 when you started treating?
past 10.
And
It was
today,
10
what
and
is your
above.
level of pain?
I would say less than 1.
So
Less
in
than 1.
4 treatments, you went from a pain level of 10
10.
out of 10 in the neck and your back.
Back. Mhm.
And we also adjusted you where you had surgery, did we
Yes.
not?
Yes, you
And
did.
what's the result in that area?
That's even improved.
And you don't feel as much pain?
I don't feel as
Do you
much
feel
pain.
a lot more movement?
I mean, I could take my pain meds before,
Yes.
and my pain level from 10, the lowest it would get is maybe a 7.
So since you've been getting adjusted, it's less than a 1
It's less than a 1
in 4 days.
in 4 days.
After 5 years or 7 years
7 years
of suffering every
of
day.
suffering every day from pain.
What do you think of that?
It feels great. I love it. You can see in my expression come from when I first started till now. It's like I can actually smile. It feels good.
Really?
Not to feel pain, yes. It feels really good.
And what did your husband say?
He says, oh, I had told him I wasn't coming back because the first adjustment you get kind of like sore. So I was like, I'm not going back. That hurt. And he says, you're walking straight. You are going back.
And?
And I came back. And I'm glad he made me come back.
Because you are?
Because actually I'm walking straight. I was walking like on my ankle.
Crooked and using a cane.
Yeah, and using a cane.
Do you need a cane now?
I still use it.
In
because
4 days,
it leaves the pressure. When I don't use it, I start feeling a little pressure. But I don't use it all the time. I can take my dog out for a walk, which I couldn't do before. Okay, I can actually walk around. She gets a nice walk. And I don't need my cane.
Isn't that great?
Yeah.
Well, thank you.
Been great.